Hello, this is Representative Pam Powers Hanley. Welcome to my podcast, A View from the Left Side. For many years in the Arizona House, my seat was on the far left side of the chamber. As a progressive Democrat and one of the most independent representatives in the House, I always believed that was a fitting seat for me. This podcast features in-depth interviews with newsmakers from all walks of life, as well as political and social commentary. Thanks for joining me on the left side today. Episode 11. With cash in the coffers, will Arizona finally invest in healthy children and families? Was recorded during the week of October 25, 2021. The Finance Advisory Committee of the Arizona Legislature met recently. This group of financial experts from the universities and elsewhere meet quarterly with the Joint Legislative Budget Committee, JLBC, to advise them and the legislature on the state's economic outlook. The October 2021 Finance Advisory Committee meeting was particularly rosy. During the pandemic, Arizona's government and residents received a total of $51 billion in aid from the federal government. These funds kept many Arizonans afloat during the pandemic and greatly helped our state's financial position. The state coffers are brimming with tax revenues and gaming proceeds. Arizona's corporations saw record profits in the past year. The Rainy Day Fund has $970 million in it, and 94% of pre-pandemic jobs have returned to Arizona. During my 5 years in the Arizona House, I have been a crusader for increased funding and services for maternal and child health. Arizona is worst in the country for adverse childhood experiences. Far too many Arizona children grow up with food insecurity, housing insecurity, and financial insecurity, while the state government gives away billions of dollars each year in tax breaks. With so much cash on hand, it's time for the Arizona Legislature to invest in the health and well-being of children and families instead of investing in more tax breaks for corporations and wealthy Arizonans. According to Arizona's 2020 statewide maternal and child health needs assessment report, Arizona has one of the highest poverty rates in the country. Between 59 and 74% of African American, Latino, and Native American children in Arizona live in low-income households. Although some of Arizonans' infant and maternal health outcomes are better than the U.S. average, racial and ethnic disparities exist in our system. Arizona's overall infant mortality rate is 5.6 per 1,000 live births, but the rate jumps to 9.2 per 1,000 for African Americans and 9.4 per 1,000 for Native Americans. Similar racial and ethnic disparities exist in low birth weight in Arizona. A few years ago, the Arizona Legislature asked for a report on maternal death because too many healthy moms were dying after childbirth. According to the same report, Arizona ranks 29th for maternal death with 27.3 per 100,000 live births as the overall rate. The rate of maternal death is almost double for Native Americans with 53.7 per 100,000, and it is 43.4 per 100,000 for African Americans. Furthermore, Arizona's report on maternal mortality found that 80% of these deaths are preventable and that 20% were death by suicide. This is a travesty of justice. Throughout the pandemic, I was wondering how the single moms and their children were hanging on. Now I know. Arizona's working families are at a crossroads. Many are struggling after losing pandemic benefits and worried about the loss of eviction protections in an uncertain world. Will the Arizona Legislature help them by easing their medical burden? Arizona's Medicaid system, the Arizona Healthcare Cost Containment System, also known as AHCCCS, has flexibility options that we can opt into, especially now that the procedures have been streamlined and now that Arizona has plenty of money for matching funds. My guest today will talk about the state of maternal and child health in Arizona and steps that the legislature can take in 2022 to improve the health and the lives of Arizonans, particularly our youngest residents. My guest today is Zaida Dedolph. She's Director of Health Policy for the Children's Action Alliance. If you're not familiar with Children's Action Alliance, they do amazing work in the state of Arizona. They provide lots of health policy suggestions, lots of data, and information to legislators and the public about trends in public health, particularly regarding women and children and families. And so she's going to talk with us today about the state of maternal and child health in the state of Arizona. I looked at data a few years ago and tried to get some bills passed, tried to get people to look at social determinants of health and how that affects women and children and families and survival past childbirth in the state of Arizona. And I didn't get a lot of traction because I got the wrong letter after my name. I have a D after my name. Could you tell us a little bit about the state of this today in Arizona? Are women and children and families doing okay? Have we made any progress?
It's hard to say because I think the scope of this issue is so big. Incremental change is important, but we have not made a lot of the incremental steps that we need to be making in order to advance this process. I probably on my tombstone will have our rate of uninsured children included there because it's something that is so important and so critically necessary to form a healthy future. And there's increasingly more information that's coming out about the benefits of Medicaid and CHIP in childhood, looking out 20, 30, even 50 years into the future. So this is something that really should be viewed as a common sense approach. We can get the kids who are eligible into Medicaid and CHIP. We can make it easier for them to enroll. We can remove all of the administrative and physical barriers that they might experience, but we seem to be a little bit stuck on that front. Looking at our numbers, Arizona has a rate of uninsured kids of about 9.4%. That's based off of 2019 figures. And that is significantly higher than the national average, which is right around 5%. When we break that down even further and we start looking at things like race and ethnicity and age and geography, almost 1 in 4 of our American Indian Alaska Native kids or Indigenous kids are uninsured. And that's huge because care that's delivered through the Indian Health Service system, care that is delivered through Tribal 638 facilities or other tribal health facilities doesn't cover all of the range of needs that a child might have. And we know that those programs have never been as well funded as they need to be to really support the health needs of our Indigenous populations here and elsewhere. We're looking at chronic staffing vacancies in IHS facilities in the range of 20 to 30%. So at any given point in time, they are lacking 20 to 30% of the staff that they need to adequately serve the population. But I think that it's a problem that needs more than one answer. So we need to fully fund this system. And in the meantime, as we're bolstering the communities that will allow for that infrastructure to be built up, we also need to be looking at other pathways to get kids the care that they need. Back up for a moment and just go Medicaid and CHIP 101. When I'm talking about Medicaid, I'm talking about the Arizona Healthcare Cost Containment System in Arizona. We call it AHCCCS for short. And when I'm talking about CHIP, I'm talking about the Children's Health Insurance Program or KidsCare in Arizona. These programs are different from other types of health insurance programs or public health insurance programs, I guess I should say, in that they're a partnership between the state and the federal government. There's a formula that gets recalculated every year, but it basically looks at the proportion of people who are living in poverty in a state and determines how much of the share of Medicaid the federal government is going to pick up based on that. And then the state is on the hook for the rest of it. It's not as simple as just saying the federal government pays for 75% of Medicaid and the state pays for 25%, because within Medicaid, we have different categories of care. So we have different populations that may be eligible for what they call an enhanced federal match or an enhanced FMAP. And so, for example, our CHIP program is reimbursed by the federal government at a slightly higher rate than our traditional Medicaid program. Our Medicaid expansion category, that's the adults who are living basically, you're just above poverty, that is reimbursed at an even higher rate. Trying to break this all down, it gets very complicated. Within that, we have some flexibility, right? So we can set income eligibility levels for a pregnant people category. That category is called SOBRA. And right now we have a pretty low income threshold for our SOBRA program. It's not the lowest, but it's pretty low. Within the SOBRA program, we are required to, at a bare minimum, cover people for up to 60 days after they deliver or after their pregnancy ends. That is the bare minimum. We can go above and beyond that, but we haven't. There are kind of two categories of folks who give birth in the state of Arizona. One are people who are ineligible for Medicaid based on their income or based on things like residency, citizenship status, etc. It's not just a one size fits all, my income is this. And so basically there's kind of two things that can happen. One is that somebody shows up, they deliver at the hospital, they don't have what they need to be eligible for Medicaid for whatever reason. Those folks, their labor and delivery and their stay in the hospital may be picked up through Medicaid as what they call emergency services in Medicaid. But as soon as they leave that hospital with that infant, the birthing parent loses coverage. And so that is tremendous. That's a real disservice that we do to people in our state. And there's a pretty easy fix to that, which I'm happy to discuss in just a moment. While I'm on this train of thought, I got to keep it rolling though. So for the other folks who do qualify based on income, and when I say based on income, we're looking at Medicaid expansion populations a little bit higher than poverty, and then just a little bit higher than that. So right now, access covers pregnancy for people who are earning below 161% of the federal poverty level. It's technically 156% of the federal poverty level. And so when we're looking at that population of people, right now what's happening is that they get coverage for 60 days. So 60 days postpartum, that's been a huge barrier in our state. It's really hard to get people in for their follow-up appointments with their OBGYN to make sure that there is no infection or other risk factors that are going on. It's very difficult to place things like long-acting reversible contraception, although I have to applaud Access. They've made that easier recently. For the people who would qualify for Medicaid based on income, they get shifted to another category. So they've given birth, they've been in one category of Medicaid, they move to a different category and stay in that category for as long as they're eligible based on income. But there is this small little pocket of people who are earning between 138% of the federal poverty level up to 161% of the federal poverty level who just lose coverage after 60 days. A couple of years ago, the legislature passed a bill requiring a maternal mortality and morbidity report to be filed by the Department of Health Services. That report is amazing. It's very comprehensive. It's laid out some strongly impactful and again, I'll say common sense can do to help address this crisis of maternal mortality and morbidity. One of the biggest recommendations that came out of that report was to extend that 60-day postpartum period to at least a year. This is best practices in the birthing world. Ideally, we'd see people covered throughout their lifespan, but a year is much better than 60 days potentially, or no days once you leave the hospital. And so one of the things that they recommended was that 12-month extension. It just got easier than ever for us to do that as a state. The American Rescue Plan Act that passed at the federal level included a provision that essentially means instead of having to do this as a big complicated waiver process in the state of Arizona, which we go through every 3 to 5 years, we can now do it as a state plan amendment, which is kind of more like a memo that we send to CMS. It's now a very simple solution to extend to 12 months. It's just about building the political will. This is a very low cost intervention that has the potential to save a lot of lives. A lot of those deaths are related to things like maternal mental health. And so instead of acting on this recommendation in the report, what we got this year out of the legislature was another study committee that's looking specifically at maternal mental health and trying to address postpartum care. And I guarantee you one of the recommendations out of that is going to be that we really need to get people the resources that they need. It's difficult to access behavioral health care. It's especially hard to access it early when you're starting to feel those symptoms of postpartum anxiety, postpartum depression. It's harder to form a bond when you are in that state. It's hard to enjoy those moments and to just do all the things that you're supposed to do and look into your baby's eyes when you are panicking on the inside.
One of the things that I looked at in 2019 was the idea of the postpartum visits. I wanted to increase prenatal care, but I also wanted to increase postnatal care. I started looking around and discovered Healthy Families, and I thought, oh, this is perfect. Well, what I didn't realize that Healthy Families used to have money in the account. Now it's got a name and it's got very little money into it. And so that was cut during the big slash and burn era, 2011 or 2010, something like that, and never restored. There's also Nurse Family Partnership. So there are those two things, Healthy Families and the Nurse Family Partnership. They're both good programs. They're slightly different, but both of them would help those moms. If you don't have the support, you can have mental health issues. Like they need that physical support too. They need that prenatal care, and they also need that support afterwards. And the Healthy Families can help you be a mom, can help you do breastfeeding and things like that. But they can also, just like the Nurse Family Partnership, they can pick up on if you're having some sort of an issue and suggest other resources for the people who have new babies at home. And so I think that it's the humane thing to do. It's going to save lives. It's going to save money. When I was looking at access to prenatal care and premature birth, I started on this trail because my granddaughter was in the NICU for 90 days. And I sat in the NICU with her. I was one of the team of family members to sit and comfort her. And in those 90 days, I saw lots of moms and babies go through there because they were there for a week or a couple of days until the child got up to a certain weight and then was dismissed. But I saw women exactly what you're talking about, where they were covered, those babies were covered for a certain time period. And these were young women. These were women that were, I would say, barely 21 years old, and many of them were maybe under 18 years old, mostly women of color. Some of them didn't even have cars. Some of them were taking a lift from the TO reservation to TMC to visit their babies. I mean, this is a dramatic situation what these young women are going through, and the idea that the state is being stingy with them, it sets the women, the babies, on a difficult path for the rest of their lives.
I'm right there with you. And I always think it's interesting. We always wind up finding money in the budget for crisis pregnancy centers, which we know are not staffed by medical professionals. We know that they're not providing prenatal care, but those pockets just close right up when you start talking about actually offering prenatal care to people who need it and postpartum care to people who need it. We have a ton of programs, a ton of initiatives that are about educating families before they leave the hospital. But what that winds up meaning is you're sitting in a hospital bed, you've got 24 hours before you're going to get kicked out. You're learning how to breastfeed. You're learning how to change a diaper. You're trying to figure out what's going on. Your body is just a wreck potentially, and you're having information crammed down your head. It's not an effective way to educate people.
I was going to ask about access to prenatal care, because when I was looking at that prenatal care data, the NICU babies are $500,000 to $1 million each, depending on how long they stay in the NICU. And so most of them are there because they're low birth weight, because they're premature. The women didn't have prenatal care. And one of the things that I proposed was money for some of these community health centers to hire promotores, community health workers, to enroll women. What I found was a lot of women were eligible. They didn't know it, or they didn't know how to get into it, or the forms were difficult. The first part of our talk today made a very good case for Medicare for All when you described the ridiculous complexity of these systems, right? Especially if you're Native American and you're dealing not only with the U.S. federal, mess of a healthcare system, but you also have IHS to deal with, and who does what, when, and when are the deadlines. How do we get more women into prenatal care?
There's so much work to be done, Representative Powers Hanley, and it makes me really excited, honestly, because I can see how much potential we have as a state and believe that we can get there. I think one thing is we need better comprehensive health education in our state. Many people don't know what pregnancy actually looks like, what it means to be pregnant, when it happens. We have just failed people. We don't talk about these things that are so simple. And as a result, we see premature births. We see the lack of prenatal care that we do. And it is also about resource allocation, right? Our investments are being driven towards centers that are spreading misinformation about human biology that have been shown to be misleading about the duration of the pregnancy, about the infant's health status, et cetera. The second thing that we really need to be doing is we need to be focusing on adult health before pregnancy. I work for a children's organization. I spend a lot more time than you might think talking about how important it is to provide adequate and, let's say, stellar healthcare to adults, because kids don't just live in a vacuum. They live in families. And we know that the parents' coverage status is one of the biggest indicators of whether a child will be covered in childhood, with health insurance in particular. Another thing that we really don't look at enough is just making sure that before people get pregnant, they are at a healthy level, that they have the support that they need before becoming pregnant, so that we can ensure, A, that they know where to access prenatal care, B, that they are set up for a healthy pregnancy, C, that we're not having to address other types of issues during that pregnancy. These long-term benefits of Medicaid and CHIP, we're not just talking about kids being able to see a doctor, although that is very important. Children with Medicaid or CHIP are about as likely to have a medical home, about as likely to receive well child visits and developmental screenings as their peers with private coverage. But when we look at the long-term impacts of that as well, we see reduced rates of disability in adulthood. We see reduced early adulthood mortality. We see increased earnings. We see higher graduation rates, not just from high school, but especially when we cover kids who are in families that are earning just a little bit more. So when we're not doing the bare minimum for Medicaid and CHIP, we see those kids succeed well beyond high school. When we cover kids into adolescence, which we haven't really talked about this yet, but we do a pretty good job at covering little kids, right? We connect them to care when they're born. That coverage is very important. But right around the time that kids turn 12, 13, they start to fall off of coverage. And that's really sad, because those are times when their bodies are changing and when they can really benefit. And, we talk about this human development standpoint, developmental screenings, they can really benefit from having a second pair of eyes on them in the form of a doctor or a physician, a dentist, making sure they stay on track with vaccines, et cetera. When we are successful in covering kids into their adolescence, we see higher earnings as adults. We see savings in terms of use of the earned income tax credit among adults who receive Medicaid as children. And we now have 50 plus years of data to look at that shows that all around, this is a tremendous investment. It pays for itself over and over and over again. And it actually has, they've found, really tremendous intergenerational impacts. So when kids are covered through Medicaid or CHIP, their own children, when they get older, are more likely to be born at a healthy birth weight than children who are uninsured for their childhood. We're not just looking at right now, we're looking at generations down the line and what we can do to build healthy families that are prepared to work, that are prepared to live, that are healthy, that are happy. We can do that all, and it's pretty easy. We just have to believe.
Thank you so much for your time today. I really appreciate all the information you gave us, and we look forward to the next session and hopefully make some cracks in that legislature to help maternal and child health, because for a state that talks about being the number one pro-life state in the country, we need to take care of moms and babies more than we do right now. So thank you so much. My guest today is Representative Kelli Butler. I have had the pleasure of serving in the Arizona House with Kelli for 5 years now, and it's been a wild ride. We served on the Health Committee for 4 years. I was sadly not on the Health Committee in 2021, but Kelli has been the ranking member for several years now. And so I brought her on the show today to talk about maternal and child health. As you know, I looked at the data with maternal and child health back in 2019 and found out that there were a lot of racial and ethnic disparities. A recent report from AHCCCS shows that really hasn't changed that much in the last few years. The system is still broken, and it seems like there's a lot of need for moms and babies in the state of Arizona. So thank you for joining me, Kelli. And could you talk a little bit about the coming session and what you're hearing for potential bills or trends in maternal and child health?
Yes, well, thank you so much, and thanks for having me. And you have been such a champion over the years for these issues around, especially the health disparities, but improving women and children's health. And it has been disappointing and extremely frustrating to know that there are real solutions that we were offering, that you were offering, that have just not made it through the process. I'm actually a little bit hopeful this year. Chairwoman of the House Health Committee, Joanne Osborne, has convened some stakeholder meetings, 2 different meetings, where we've discussed opportunities to expand Medicaid coverage in particular, expand different programs within our Medicaid program that would really address some of these disparities and really improve access to care for hundreds of thousands of people in Arizona. You always have to enter a session, I think, with a little hope, or else I don't know how else you would do it. But I am hopeful that some of these ideas might be able to make some progress this session. I'm really, really hoping. We're having good conversations.
It's great that you're having good conversations, because often in the past, we weren't even invited to those meetings. A few years ago, they said, oh, don't worry, Kate Brophy-McGee is going to fix this whole problem. Well, we were never invited to those meetings. So how can these be fixed when it's only one side looking at it? I'm really glad that Representative Osborne is doing this, because I do believe that she is one of the more reasonable Republicans in the House that we work with.
Yes, and other Republicans were attending the meetings as well. And the format was to discuss, I think we had, 7 different opportunities to expand different Medicaid programs. And so we heard all 7 of them. We heard from Director Jamie Snyder, the Director of Access, about the cost for each program and the number of people that would be served. And then somebody got up and gave about a 30 minutes applied for each of these programs to kind of describe and advocate for the one they were there to talk about. It was a real nice in-depth look in a setting that is unusual. And it has left me feeling really hopeful. As more people become aware of what is possible, it pushes and applies more pressure. There's no reason we should have one of the lowest numbers of children who are insured in Arizona. There is no good reason why we should be having such poor birth outcomes and, having mothers' health being really at risk in Arizona. There's a lot of things we can do to fix it. I have been pushing for an expansion of KidsCare, which is our children's health insurance program. It's largely paid for at the federal level with matching dollars. The newest estimates are that if we expand our KidsCare to just the U.S. median of eligibility, so just what half of the other states are able to do in terms of allowing people to be eligible for the program, it would make about 22,000 new children eligible and likely to enroll. It's very affordable. It's about $11 million from the state, brings back about $70 million in our federal tax dollars back to invest in children here in Arizona. KidsCare is for families who are working. It's working families who are not earning enough to afford insurance on their own because insurance is too expensive. It is robust, comprehensive insurance for their children, and it is extremely affordable at the state level. I'm hoping we will be able to take a look at expanding KidsCare. The other one is the dental benefit for pregnant women who are on access and, allowing them to receive comprehensive dental care for oral infections. It's not hard to imagine that your oral health is physical health. And this expansion would allow women who are pregnant to receive oral health care, which is correlated with better birth outcomes, higher birth weight babies. You and I have talked a lot about how just 1 or 2 premature births would pay for the whole program, because premature births are not only awful for families and for children, but extremely expensive for the state. So we're talking about that benefit just for pregnant women, but we also talked this year in this meeting about expanding dental benefits to all adults on access, which would be, I think, life-changing for people. And, many people know my husband's a dentist, and we've seen so many people, and everyone knows someone who cannot afford dental care, especially families and people who are on access. That dental benefit, we talked about it today as such a workforce issue, and also cost savings. Clean somebody's teeth and maybe fill a cavity is way less expensive than having to do a root canal and a crown after the problem has gotten worse. So talking about that too, which would be really exciting for people on access to get. We talked about people who are missing teeth, and it's very difficult to present yourself for a job. And if you're missing teeth, and that's completely something that we can do something about and fix. So in addition to those, postpartum coverage, the Biden administration is, I think, incentivizing CMS to expand postpartum coverage. So right now, if you're on access, you are only covered for 60 days days after you give birth. And you're well familiar with this, I know. And the CMS is now allowing states to apply to expand that postpartum coverage for a full year. Extremely important. And to imagine that person who gives birth can have that follow-up for a full year. And I will tell you, we learned in the meeting this week that 80% of pregnancy-related deaths were determined to be preventable. 80%. And two other worse statistics than that, or as bad, more than a third of those pregnancy-related deaths occurred between 42 days and 1 year postpartum. So right in that time frame where we need to expand the coverage, obviously. Really disturbing is among all pregnancy-related deaths, nearly 20% were death by suicide. So obviously, new mothers, new family needs to have access to mental health services for postpartum depression and those kind of issues, but also for physical health issues. And that expansion to 1 year will absolutely save lives and improve outcomes for mothers and babies. Really compelling data to show us that it would make a huge difference in Arizona and is very doable. There were some other expansions discussed, allowing chiropractic care and expanded physical therapy for people who are injured and on access, and possibly reducing opioid dependence that occurs when people have these chronic pain conditions, hopefully getting them better treatment options, and diabetes self-management. We had that bill last year and it didn't make it through the process, but kind of unbelievably, just trying to allow access to pay for people to understand how to manage their diabetes was too big a lift for us at the legislature last year. The Republicans weren't supporting that enough to get it through. This time, I think we're having better conversations about that. But all told, all of the things I just talked about have a total price tag for all of them of less than $50 million. $50 million sounds like a lot. But when you think about, we cut $2 billion in tax revenue last year, and all of these expansions for hundreds of thousands of people to make them more healthy and to help them access care with only a price tag of $50 million is very doable, especially in this economy right now. And it's exciting to think about what's possible if we can get some more Republicans on board.
As you mentioned earlier, there are statistics, I guess, in maternal and child health, for example, premature birth and low birth weight babies. If we actually improved those statistics, we'd save far more than $50 million. We would pay for the whole dang thing. And, diabetes care, I believe I mentioned to you once before, I had an admin assistant who worked for me when I worked for the university. And when she was diagnosed with diabetes, she had those self-management classes, and they helped her so much. Again, there's a tiny bit of public health prevention that can be done with these people. It's a small price tag at the beginning, and it'll save us millions or billions as a state with the maternal child health, the diabetes, the chronic pain management, all the things that you listed. It's very exciting. It's a very good thing. And as you say, we're paying this slice of it, and the federal government pays for the rest of it. So why not do it? I remember when Governor Jan Brewer signed on to Medicaid expansion, she says, well, look at the money. It just makes sense. I don't often say we should follow Jan Brewer's lead, but here we go. Why not expand it and help families and children and moms lead healthier lives? So I'm very excited. I wanted to ask you about the postpartum care, because that was one of the things that we looked at a few years ago, because there was the study from the legislature, I believe it was in the Senate, that looked at maternal death after childbirth. And they had that very sad story about that woman that was reported in the Republic. And it was a happy time for this husband and wife when they had that baby. And then all of a sudden, the husband has the baby and no longer has his wife. And this was a postpartum care issue. So I was wondering if you could speak to that a little bit more.
After that mother died, it caused us to do something, and that something was to at least collect the data, which sounds like not nearly enough when common sense would tell you expanding coverage for care would make a whole lot of sense too. But at least we were able to collect the data, and so it led to us really understanding the problem more thoroughly, and again, getting to these numbers like 80% of those pregnancy-related deaths were preventable. Totally tragic issue. It's good that some good did come out of it in that now we have data to use to really make the case. In these meetings, it was interesting because we're trying really hard to make both the case for healthier human beings that we care about, but also trying to really make that economic case too about why saving lives or improving lives and helping people be healthier saves money, lets people go to work. If they go to work, they can get off of access and earn more so that they don't have to use these programs. So it's just common sense. And sadly, in the meeting, some of these programs have a lot of lobbyists who are there, who are able to do all of this research and provide this data. And many of the groups that are there trying to expand coverage have a lot of resources and lobbyists. Women and children don't have enough. And so you're sitting in those meetings and we don't have glossy flyers very often. Those groups are running on shoestrings and a lot of heart and hard work, but not money. I think that has skewed the conversation at the Capitol. And we need to get back to just talking about people. Lives can be improved if we make sure that they have access to healthcare.
Exactly. In fact, I was looking at a 2020 report. It was an assessment report that the state has to do every 5 years in order to get their block grant money for maternal and child health. And it's 130 some pages long. I have not read the whole thing, but I've kind of skimmed some of the high points. And it appears as if there's definitely still disparities across racial and ethnic groups in the state of Arizona. And I saw that in 2019, that definitely Black women, Native American women, and Latinas had worse access to care issues and worse outcome issues than white women. And you see that is still in that report. So I would think perhaps some of these steps to expand Medicaid would be related to the data that's in this report that said there's obviously still issues in the state of Arizona with care, particularly among certain groups of women.
Absolutely. It's the conversation you've been trying to drive for years. And it's awful because we know some of the answers. We know that there are steps we can take to help women get better care. And it's so frustrating that we just haven't been doing it. I know that you've run bills in the past to expand like home visiting options where people in the community who are part of someone's community and can go into homes and give advice and offer resources and things that are needed. Tried for years to expand those kinds of programs that truly have wonderful outcomes that we can point to. But again, it's frustrating to make that case because too often the folks on the other side of the aisle only want to hear the economic case.
Well, I really appreciate you joining me today and having some good news. Like you said, we always have to go into the session with a positive attitude.
You have to have hope or it would be an even more dire place. We've been through a lot in the last 5 years, but I am hopeful this time. Often it takes years to pass a piece of legislation, and maybe the work that you've been doing that I've tried to do too, maybe it will pay off at some point and we can get some better coverage, better access to care for people that really need it. And we have such an opportunity right now, and our fiscal position is good as we're going into the session. If we can make the case to invest those dollars in people in Arizona, in hardworking families, and especially in their health, that investment is really going to pay off.
That's right on the money. I really appreciate your time, and that was perfect. Thanks so much. Thanks so much for tuning in to A View from the Left Side today. If you enjoyed the show, please consider liking this podcast on social media and becoming a subscriber. This is Representative Pam Powers-Hanley signing off. Until next time, please take care of yourself, stay healthy, and stay vigilant.